Okay, welcome back to the ECG learning series, and today we will talk about the UFs. So by definition, what is the UF? The UF is actually a deflection that is following the T-wave. So whenever you have the T-wave, sometimes we will have like a very tiny small deflection that comes right after the T-wave. And whenever you want to assess the normal U-wave is the best seen, actually U-wave is best seen in leads V2 and V3. Okay, so this is the most EKG leads that are really great to assess UFs. Just remember that when we were assessing P-wave, we were looking at lead 2. Okay, so P-wave is actually different from the UF. Now, what is the source of UF? Actually, the source of UF is really unknown. We don't know for sure why UF happens, but there is a very acceptable phenomena about that says normally in certain circumstances and certain people, Purkinje fibers will have delayed repolarization, and this delayed repolarization will give me the UF. And just remember that a delayed repolarization also the ventricular repolarization is giving me the T wave. So also UF is caused by repolarization, right? So if the UF is normally seen, it should be the same direction as the T wave because both of them are representing the same electricity current, which is the repolarization. So if you have a normal UF, you will best see it in V2 and V3, and it will have the same direction as the T wave. And a rule of thumb here, the UF grows bigger as the heart rate slows down. There is an inverse relationship between the UF and the heart rate. Because if the heart rate is slower, guys, it will give you more time to record any electricity from the heart, okay? Because there will be like a huge space or enough space between each beats. So any electricity that is will be generated will be recorded by the EKG leads, okay? And normally speaking, the maximum normal amplitude for the UF is actually 2 small squares. If it is larger than 2 small squares, we will say this is a prominent UF, and you think about certain pathologies, we'll talk about them. Okay, so what is a normal normal UF? As you can see here, it's best seen in this EKG on V2. We look, this is the T wave here, and after that we have a small positive deflection, the same direction of the T wave, and it's really less than 1 small square, which is normal here. Okay, this is representing the UF, and most likely it is because of delayed repolarization of some Purkinje fibers. Okay, so what can cause a prominent UF? And when we say prominent UF means that the amplitude of it is more than 2 small squares. We always think about hypokalemia, especially if it is severe, and you think about bradycardia. And the slower the heart rate is, the more prominent you will find the UF. Those are the most common causes of prominent UF. And for hypokalemia to cause a UF, it should be severe, meaning that the potassium level should be less than 2 milliequivalent per liter to cause UF on your EKG. Also, UF can be also seen, a prominent UF can also be seen in cases of digoxin toxicity and in cases of hypertrophic cardiomyopathy and left ventricular hypertrophy. So in those cases, when we have a hypertrophic cardiomyopathy and left ventricular hypertrophy, the muscle itself is enlarged, meaning that also Purkinje fibers are enlarged, right, by definition. And this will cause a prominent UF as well. And just remember that many of the conditions that are causing prominent UFs are also causing a long QT interval. Just remember hypokalemia and bradycardia, both of them are associated with a long QT interval. And we will talk about long QT interval in a different video. All right, now let's see some cases here. Okay, I'm sorry. So we say this is the UF, and we see that here. Okay, now in UF, a negative. What if you find a negative UF? If you find a negative UF, this is very highly specific for the presence of heart disease. Let's identify some UFs. This is a UF, guys. How I can identify it? You have a T wave here, and it's followed by a negative deflection, which is the UF. another one here is this is the T wave and this is the U wave. T wave here and the U wave here. T wave here and the U wave here. And if you ever see a U wave that is an opposite direction to the T wave, this is totally abnormal. By the way, this is V1 and this is V2. Okay, now, if patient is presenting with a chest pain, an inverted U wave, as you can see here, is highly specific for a presence of myocardial ischemia, either unstable angina or non-ST segment elevation MI. It's really very specific, and it could be the earliest marker of unstable angina. Okay, so pay attention to an inverted U wave, as it could be the only abnormality in EKGs earliest in patients with unstable angina, and can help you identify those patients quickly to start medical therapy. Okay, that's it about U wave, and I hope you enjoyed the video. Thank you.